Great. Thank you. Thank you. Yes, Siddheesh, I think we should start.
Yes. So I think we can start. So good evening, everyone. I am Dr. Siddheesh, Academic Director in CLIMAT, and one of your faculty for Pharmacotherapy module. So we have planned the Master Certificate course for Pharmacotherapy for you all, in which we have planned around 5 to 6 modules covering all the major organs, including gastro, nephro, endocrine, OBGYN, dermatology, infectious disease, neurology, and psychiatry, and all. So in module 1, we are starting with the cardiology and the respiratory disease, and we are covering all the major disease, including hypertension, heart failure, dyslipidemia, stroke, asthma, COPD, cystic fibrosis, and all. In the end of the class, I'm going to share this entire brochure with you all, so no need to worry for the syllabus part as such of now. Now, after completing each module, you will get certificate of completion. And once you achieve 70% of attendance and 60% above marks, you are able to get your certificates after each exam of each module. Once you are done with all the modules, like suppose if you are having 5 to 6 modules, then you are eligible to achieve to get the master certificate in the pharmacotherapy part. So what we are going to do in each module, we are learning of organ specific disease. We have 3 to 4 case discussion in each class. We will learn how to read X-ray, ultrasound, CT, MRI of disease specific imaging along with the lab values as well. Now the main thing what we need from you, we need only one thing, that is your active participation, your active discussion in each class. Even though we will share the recordings with you all, but I need you all to come to the live classes so we can have a proper one-on-one discussion. As you all are family, as far I know, we will also conduct some case discussion classes for you all people, in which you have to present the case of your choice from that module only. Suppose in module 1 we are doing cardio and pulmo, so you have to present a case with respect to cardio and pulmo, and we can have a group discussion on the same as well. So let me show this brochure with you. So this is the module 1 brochure in which we are covering cardiology and the respiratory disease. Now in this part, we are targeting a few important topics, that is hypertension, systolic heart failure, diastolic heart failure, acute heart failure, ischemic heart disease, dyslipidemia and stroke with respect to cardiology. For pulmonology, we are covering asthma, COPD, pulmohypertension, and cystic fibrosis. So this will be for around 2 to 2.5 months. So after the completion of the entire syllabus, we are going to have an end exam in which you have to score above 60%. Also try to maintain your attendance of more than 75% to get into the examination. So today we are starting with our orientation class, and from next week we are starting with the entire class. So we will start with the hypertension. And also in our class, we have Dr. Ajit sir with us. Over to you, sir. In the meantime, if you have any doubts, your
Hi,
if you
guys.
go,
Yes, yes, my mic was off. One sec, guys. One sec. I think my bad.
no issue, sir. So for the others, like if you have any doubts or any questions, you people can chat with me. No doubt, if you want, you can talk to me as well. I'm happy to answer all the doubts or questions, whatever you are having.
Hi, guys. So sorry, mera. I mean, I had no battery in the laptop. Okay. So, okay, there are some questions we'll take later. But guys, as you can see in the screen, there are 7 modules right now we are fixing. Okay. As Dr. Siddhesh told, in first module, we are covering cardiovascular disorder, respiratory disorders. And in that, we will have around 10 classes. Okay, then GEC, renal, then neurology, psychiatry, then endocrinology and rheumatology, then urology, gynecology, then infectious disease, antimicrobial, and then dermatology and hematology. But guys, along with that, let me tell you, some people ask me, why didn't you include the oncology in that? Okay, yesterday only a few of my interns messaged me. So for you guys, we are coming up with a full-fledged course in oncology. Uh, Maybe by next week we will be launching that. Okay, and I'm getting many questions about the fees also. Like how much will be the fees? So as we are charging 499 rupees for each session, it will not be increased at all. Okay, it is for 499 rupees for each module only. And in that also, we are giving multiple offers to the scholars who are scholars, they are getting in 249 and all, like 50% discounts and all. I'm not sure if it will be continued for the next time also, next module also, but your fees will not increase more than 499. For every module, you will be just paying 499 rupees, and you will be getting master's course certificate once you are completing all the modules. Okay, now let me come to the other than the technical part, guys. First of all, I would like to thank you all for joining this wonderful course, and we are starting this today. And I would like to invite you all for tomorrow's session. Also, tomorrow we have the session on gastroenterology, like NEFL. Dr. Siddheesh is going to take that session, and that session is going to be amazing. Frankly, if I'm telling you, right? Because this is a master class on NAFLD and MI. The like tomorrow, Dr. Siddhesh will be taking, and on Monday, I'll be taking on myocardial infarction. Now, other than that, what is the use? I'm seeing like what is the importance of this program? See, being a pharmacy person, pharmacotherapy is pharmacotherapy is the utmost important subject. Let me tell you why. If you are either a pharmacy practice person or a pharmacology person, pharmacy practice means M.Pharm pharmacy practice, B.Pharm pharmacy practice, or the PharmD. Okay, majorly the PharmD. You have to work in the hospital, and when you are working with the patients, pharmacotherapy is the only subject which you need to understand the most. Okay, which you need to understand the most. And see, we are running already, cardiovascular, we are running gastroenterology, we are running, nephrology, but we thought to combine everything and to get this course on the top recommendations and based on the top reference books. Okay, top reference books. You must have seen in the brochure also that what we are following. We are following the top reference books for to teach you, right? Best reference books, right? And based on that only we will be teaching you. There is no like substandard teaching. We'll be teaching you from the Harrison, Davidson, DePiro, and all the other high-end textbooks of pharmacotherapy. So you will be the master of pharmacotherapy. You will be learning a lot from this course, and this course is very, very important. Okay, for all the pharmacy people, if you are working in the research in the industry also, like a medical writer or maybe the pharmacovigilance officer or in the pharmacovigilance or like whatever it is related to the drugs, right? It is related to the drugs, and along with drugs, if you are knowing the pharmacodynamics and pharmacokinetics, both, you know both, you are the pharmacology person, right? And if along with those pharmacokinetics, pharmacodynamics, or with the drugs, I mean these three things, around about the drug part outside the body and about the drug inside the body in the part of pharmacodynamics and pharmacokinetics, right? Then you will be the master of from the manufacturing or maybe the regulatory affairs or the medical writing or the pharmacovigilance, because you will be understanding the entire scenario, how drug can act inside and outside the body, right? So that's why it is a very, very after a lot of thinkings, we came up with this course for all of you, right? So you can understand the entire pharmacology, pharmacotherapeutics here about the drugs and about the diseases, right? And so it is very important. Literally, if I say, according to me, it is very important, and it's a worth doing course for all the pharmds, all the B farms and M farm pharmacy practice pharmacology people, and like it is something very good. And not only the pharmacy people, pharmds, but to the nurses, to the other healthcare professionals. If they want to join, they can definitely join such courses. See, now I'll come to the most important part of this course. Like, the people always ask, like, I mean, that tradition with CLIMAT, that if you are attending even the one module of the course, you will get the certificate. People were asking if we are getting the certificate for each module also. Yes, you are getting the, each module certificate separately. And if you are conducting, I mean, if you are attending all the modules, you will get the master certificate also at the end. This course is not very, small. If I say like it will be finished in 1 year, not at all. It will go for almost 15 months. Okay, it will go for almost 15, 16 months. So I can expect that this will be ending, this course, entire course will be ending by the August 2025, right? August 2025, right? But each module, if you are patient, then you can join all the modules. And definitely I would suggest you to join all the modules. And if you are like, okay, I want only one or two interesting modules, you can join in between also, and you can, complete those modules only, right? You will get the separate certificate, and fees is also very limited. And now let me tell you, we are having the experts to teach you, right? Who are the PhDs in these subjects, who are either working on the specific subjects, or who are the doctors to teach you. And along with that, you will be getting the live case scenarios. Okay, live cases, we will be teaching you based on the live cases. And yes, mechanism of actions also will be included, side effects will be included, patient counseling will be included. I mean, everything related to the drugs, disease, everything will be included. Yeah, drug classes, and the treatment algorithms, everything will be included in the classes. Okay, and not only that, the diagnosis part, very important, the diagnosis part, either that is ECG, core treadmill test, or radiology, pathology, or biochemistry, everything will be included in this. Okay, so happy learning, guys, and you can definitely enjoy this. If you have the questions, Dr. Siddhesh is here to
So we have first question from Mohit. So Mohit, actually we are covering all the major disease from Dipro, from Harrison, what we are facing in the daily basis. So we are covering all the aspects. In between, we are covering the some minor disease as well. So overall, we are covering the entire syllabus only. Ramya, I'm not sure if you have joined gastro classes. So, but you will definitely love our classes, no issue. We have some different way of teaching with some live ultrasound, CT, MRI images, and even though we have some images for the pathology part as well. So we do have some interactive case discussions, live case discussions as well. So it will be happy learning from both the ends. Mohit, again, it depends on the disease what we are covering. In some, like in this session, module one, we are finishing up within 2 months, and 2 months, probably by 2.5 months. So every module will be covering around 2.5 to 3 months. Yes, Alisha, we are covering entire MOA of each drug classes that we are practicing on daily basis. Also, we are going to teach you what dose and what is the frequency of drug we have to give, and what are the available formulations as well. After we have around 7 modules because we are covering the entire Dipiro or Harrison and the major super specialty departments. So we are covering the entire things in around 7 to 8 modules.
Yeah, people are asking about the timings and the days also. So I think this we are taking the classes on Thursdays, right? Not the Wednesday.
Yes, we are taking on every Thursday from 7 p.m.
Yeah, every Thursday from 7 or 7:30 on the convenience only, guys. So we'll definitely take the class after 7, so everyone is free and everyone can come to this. So from the 7 p.m. every Thursday you will have the class. Okay, every Thursday, every Thursday. Remember that we will share the schedule also with you, complete schedule. Yes, it will be helpful. I think pharmaceutics department entirely, if you're working in the formulations and all, definitely I'll say it is helpful. But I mean, it is helpful for the pharmaceutics department also. There is no way that it is not useful for you guys. Sir, I have already master certificate of gastro and cardiac, so I need to attend again. If you want to get the master's course after BS, and this is different. I mean, there will be some diseases same, but we have the separate modules also. Classes will be 1.5 hour, 1 hour to 1.5 hour usually. Can you teach from the basics of ECG readings in module? Basics of ECG, we have the separate course. We have recently concluded that course. Okay, guys. So thank you very much. Take care and we'll see you. Siddheesh.
Yes, so just one thing. So tomorrow we are having class on NAFLD. So if you really want to learn NAFLD and MI and the way of teaching the interaction case discussion, do join the session so you will have the basic knowledge what we are going to cover up in the next coming modules.
Yes.
So from that master class, you're going to learn multiple things and the same way we are picking up for the each module. So do come to our module, our master class, so you can have a brief. So what we are going to cover up in the next coming year.
Yeah. What is that? We will provide you free of cost, guys. For you guys, do not have to pay, but you will not get the certificate for sure. We will provide you the classes free included in the pharmacotherapy module 1. Don't worry. Okay, you don't have to pay for that. Okay. Yes, guys. Okay, chalo guys, take care and good night. We'll start the course from tomorrow. Okay. Thank you, guys. Thank you. So this
Yes, yes, we can wind up.
get ready.